So the next common injury that I'm going to be talking about for a person who wants to take up sport as his active lifestyle is going to be back. Now, back is a sensitive factor to discuss about. One of the reasons is because many times back is a chronic injury that can go on for very long. You could have had a back issue for years prior and it could have completely disappeared, and just because you started some kind of an active lifestyle, it might either go into a spasm or in one of the chronic injury spaces. Having said that, there are few things we can still do to prevent a back injury, and things that we can make sure that it can cure in case you went into any kind of a spasm or a problem. So one of the first things is get the right footwear in place. Second is, yes, getting the core strengthening done, getting your back strengthening done is extremely critical. Icing in case of inflammatory processes get aggravated, and getting your posture correction where there is not much of hyperextension that happens. Weight is one of the factors that can result into back issues. So if you are overweight but want to take up a sport, say for instance running, or you want to take up a sport like a racket sport like squash, make sure that you are also parallelly working on your weight to make sure that you don't land up giving too much or excess pressure on the back when you are training. When you are doing some kind of agility sports like a squash, moving around as an overweight person, you need to make sure that your posture, your warm-up and your cool down is bang on. And it would be best if you tried to do a certain kind of strengthening exercises before you started a core agility workout like a racket sport, and hence can thereafter, if you get that alignment correct in the back, you can prevent any kind of a back spasm or a back pain. What are the other underlying factors is to get your calcium and D3 obviously correct. We also need to make sure that these major joints, which was also knee related and back related, there is no history of gout or high uric acid levels, because even that can result into some kind, it can flare up with some kind of pain. Keeping that in mind, getting your hydration bang on, making sure your salts, your sodium, your potassium, your chlorides are in place as well to prevent any kind of a spasm through these kind of sports, and anti-inflammatory supplements such as omega-3, which can either be in the form in your diet in the form of flax seeds, or it can be supplemented in the food. So these are a few know, tell, cure, prevent where back is concerned, and keep watching this space for more information on other injuries.